Hello and welcome to Health Professional Radio. I'm your host, Neal Howard, here for this Health Suppliers segment. Our guest is Mr. Mike Crowley and Scott Aronson. Both of them are here with Jensen Hughes to talk about the recent acquisition of Russell Phillips and Associates by Jensen Hughes, and also to talk about fire safety and life protection in large healthcare facilities. Welcome to Health Professional Radio, both Mike and Scott.
Thank you for having us.
Mike Crowley, you're the VP of Development for Healthcare at Jensen Hughes. Give me a little bit of background about yourself.
Well, I'm a fire protection and safety engineer, and I've been working in the healthcare field since early 1980s. I've been active working with design professionals and the built environment and, applying building codes, life safety code to healthcare. I'm also very active in the NFPA code writing process. So, I could say I'm also part of that challenge of writing these regulations that affect life safety in healthcare facilities.
And Scott, as a principal for RPA, what's your background?
Sure. So my background is I've been dealing with research of fires and disasters since about the 1994 range. And so personally, I've gone down to Hurricanes Katrina and Sandy, the California wildfires, Joplin, Missouri, after the big tornadoes hit, and have done the research of what took place in these disasters, and then bring that information back to how do we deal with hospitals and nursing homes and other healthcare providers in making sure that we can develop the procedures to protect the patients in the organizations. And so I have a master's degree that also covers concentration in Homeland Security Management. And most of the time I've done things like I light myself on fire for a living. You don't get to say that every day.
No,
so
not every
we've
day
worked with worked with the hospitals and ambulatory surgery centers on how to put out a fire on a patient if it ever happens and rapidly manage that. And to do that, we put them through realistic training. So that's kind of where I've lived these past 15 years until Jensen Hughes acquired us.
Mike, what are some of the unique challenges when dealing with fire and life safety in a healthcare facility of some substantial size?
We have occupants, patients that can't move or can't be moved. So we need to have a little bit higher degree of safety than you would in a normal office building or even in a hotel. Because we have to protect that patient or person in place. So we have a lot of redundancies in our safety systems. A lot of them, most people won't even recognize when they walk through a hospital, but they're all there. Starting with the door to the patient room, then we have a smoke barrier door, we have floor-to-floor separation, we have suppression, we have fire alarm systems. So we have all of these life safety features interlaced in the design, and you can tell a design when the design team started out trying to integrate it all into the design. It looks very, very natural. And you've probably seen some facility that's been retrofitted and it looks kind of awkward and clunky. And again, this is from an engineer's view, maybe not an architect or someone who has a little bit better aesthetic eye than me. So.
And Scott, from your perspective, talk about the benefit of this recent acquisition of RPA by Jensen.
Sure. Yeah, we kind of look at it as we were one major piece to the puzzle with Jensen Hughes. And we've always worked in similar space. We have a few crossover services. But the fact of the matter is that the RPA focus has always been on the hands-on training and procedure development to protect the patients. So we'll run them through the exercises and put them into the real disaster scenarios. And Jensen Hughes was on the modeling side and the design side, and we came so close in crossing in the middle that it was a perfect complementary service for being able to really look at the fire modeling and what happens within the building and the structure and bring it together with what the patient needs on a day in, day out basis. Like, we are the only company in the country that knows how to evacuate a patient during bypass mode of open heart surgery. And there's not many people that can say that's something they ever want to see, for one, ever have to do. But at the same time, it takes an extremely specialized approach to get to that level of understanding the fire protection features of the building, the staffing that are there, and then the patient population themselves.
Has this acquisition streamlined the way that information is given to staff and to patients so that they can more efficiently evacuate or protect the lives of their patients in a situation that warrants such?
We do want to be sharing the information across the platforms. We bring to the table a lot of expertise on the built environment, and RPA brings together the training and integration with that built environment to the staff and, for the protection of the patients. So that is the key. I think that was our strongest point we put forward in discussing this acquisition, and I think it's going to provide our client base that fuller range of services when they go into operations for a building, or we do a renovation to a building, or actually if we don't even do the building and RPA has been providing the services and they need remedial work. They need a new fire alarm system. They need sprinkler systems. They need to do some renovations. We can help on that end of it. So I see it broadening all of our services that we provide. So that's the nice thing about it.
And where can we go online and get some more information about Jensen Hughes and the recent acquisition?
Well, you can start with www.jensenhughes, JensenHughes.com, and you can look on our news feed on that on our site, and I think you can also hit it at Russell Phillips, and I'll let Scott spell that one. I'll screw it up.
Sure. You can also go to phillipsllc.com. So it's phillipsllc.com, and that's got all the details about the integrated technology that we bring to managing disasters, as well as the specific services for the hands-on elements of this.
Mike Crowley, VP of Development for Healthcare, and Scott Aronson, Director of Strategy and Business Development for Healthcare at recently acquired Russell Phillips Associates by Jensen Hughes. Thank you so much, both of you, for joining us here today.
Thank you very much, Neal.
Yeah, thank you, Neal.
You've been listening to Health Professional Radio, this Health Supplier segment. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. Subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.